I've been working in AI for about 40 years, and it's always a pleasure to talk to others about their view on the topic. We never called it AI in our field. We always called it machine learning. And AI, unfortunately, was brought back from the death throes and is being used for this technology. And it's not very accurate as a terminology. And I want you to learn a little bit about that in my talk. So first of all, if you interact with ChatGPT or a language model and you ask a question about mathematics or physics, you might get an answer that comes from one of the people in this room, something they wrote back in the past or their students. If you ask about hip-hop music in Brooklyn, you may get an answer from some other crowd of people, or restaurants in Shanghai, et cetera, et cetera, et cetera. When you're interacting with ChatGPT, you're really interacting with all of humanity, billions of people who've contributed to it. It's a collective. And not only are you interacting with it, but billions of people are interacting with it as well. It's a collective on both sides, the producer and the consumer side. The systems that are being built with these things are not simply a secretary to help you think. They're also underlying the world's logistics chains, the world's healthcare systems, the world's transportation systems. So they are large-scale networks composed of many, many stakeholders in many, many pieces. Data is flowing among these pieces, decisions are being made, things are being shared, there's collusion, there's cooperation, and so on. So as that diagram suggests up there, we're going to all be immersed, we already are, in a system with many, many humans and many, many pieces of AI. It's not that there's a superintelligence on a hill that we all consult, we're all enmeshed together in this thing. So in this diagram there, the AI is in the overall network. It's not simply in a box. Now, if you take a collectivist point of view, you're already in the world of microeconomics. So if you ask, where's the AI? It's also in the connections. It's also in the economy that arises when you put all these pieces together. And so a new version of AI needs to be built that's not simply data analysis and prediction. It's also microeconomics. Now, when you think this way, you start to realize there's some serious problems of bias. If I'm enmeshed in a network and data is flowing at me from other people and other entities, they may have their own agenda. They may be strategic. The data may be false. Even if it's not false, it may be biased severely. Here's an example that we've studied in our group, AlphaFold. You all know it's extremely accurate, major progress. It is a foundation machine learning model, or AI, if you choose to call it that. Now, here is an example, briefly, I'm not going to get into details, of a study that was done in 2004, studying whether proteins who have quantum fluctuations also are used in the cell. They're active in the cell. Quantum fluctuations often means you have a strand hanging off of the protein. It didn't fold, so you might think it's a bad protein, but it turns out it's probably used in the cell. When this was first studied, there were about 10,000 entities in the protein data bank, and there was not enough power to reject the null hypothesis. 20 years later, instead of using data, AlphaFold output, of which there were 200 million proteins, was used to replace it, and you rejected the null hypothesis completely convincingly. Very small error bar. The problem was it was extremely biased. So in this slide, you'll see a statistician slide, mine, where on the x-axis you have a certain statistic. If the value is 1, there is no association between quantum fluctuation and phosphorylation. The gold little region there is a confidence interval coming from AlphaFold. It's very, very narrow. It's very sure of itself. But the truth is the dashed line there. It is not covering the truth at all. And we've seen this in domain after domain. We have a paper in Science that shows this. A classical statistical confidence interval is the gray region based on all the data actually in the protein data bank. It is covering the truth, but it's way too wide. It also covers the null hypothesis, and you, again, can't reject even after 20 years. Long story short, we have a new procedure called prediction-powered inference. It's a new advance in statistics that allows you to correct confidence intervals from things like foundation models that are incorrect, overly confident. It moves it over to provably cover the truth and makes it a little bit broader. It's honest. The message here is that foundation models may be very good overall, but they can be inaccurate if you're a problem. You shouldn't trust them completely. You should use them, but not trust them. And here's the reason why this happens in AlphaFold. Here's an example of a prediction on the left and the actual structure on the right. It completely missed the quantum fluctuation. Why? Well, because in its data set, there wasn't many examples of this. Why? Well, because scientists are mostly interested in being on the boundary of knowledge. On the boundary of knowledge, there's not so much data. It's very good at all the past knowledge, and poor at the boundary. This is going to continue to be an issue for foundation models. They will be very good at the past and not so good at the boundary. Is that a problem? Yes. Can you correct it? Yes. Prediction-powered inference and simpler methods could do that. In my remaining 1 minute, I want to mention the other issue about bias that arises more in an economic sense. There are incentives at play when data flows. So clinical trials cost tens of millions of dollars per year. The right way to think about this is it's not simply a statistician analyzing data and deciding what medications go to market. It's a principal-agent situation. The principal is the regulator. The agent is the pharmaceutical company. The agent is supplying proposed medications, proteins, and the agent knows something about that the principal does not know. The principal has to do a blind test. So the bias is coming from the particular hypotheses that are sent to the principal, to the regulator. And if you ask how a regulator should test, a statistician will tell you to follow the table at the top. You see that the type 1 error, the false positive rate and the false negative rate are very low. That's very good. But if you put this in an actual real-world situation, you have incentives. If there's not much money to be made from this particular protein, even if your drug is not very good, you're not going to send it in. But if there's a lot of money to be made, if your drug is not very good, you will send it in and hope for a false positive. Those are the incentives at play that leads to lots of medications going to the market that are not actually effective. So again, this is a problem that can be solved. We have developed a new technology called statistical contract theory, which takes the idea from economics of a contract, a set of options like business class, economy class at different fares, and then turns that into a data analysis setting where you get different kinds of reward depending on the outcome of an experiment after you make your choice. Okay, so this is algorithmic design that blends data analysis and microeconomics. And if you want to think about what this is in the context of the word AI, to me, AI is the overall technology of our era of how to design systems. It's a problem-solving enterprise. It's not a technology. It's not ChatGPT or AlphaFold. It's the problem-solving mentality that went into the design of those systems. And we're only partway there. We're very much getting started. Thank you.